Vajpayee. I'm a medical oncologist heading the Department of Medical Oncology at Manipal Hospital, Dwarka, New Delhi. This is the month of September, and this is also called Ovarian Cancer Month, Ovarian Cancer Awareness Month. Ovarian cancer, or the cancer of ovaries, is basically a very common cancer in Indian females. It ranks third amongst all the cancers if we look at amongst the Indian females. The top cancer is breast, the second one is cervix, and third comes ovarian cancer. Nearly 50 to 60,000 ladies are diagnosed with ovarian cancer every year in India. The magnitude of problem is that nearly 50% of the patients do not make it to the 5th year after their diagnosis. And this is because the presentation of ovarian cancer is in usually a very advanced stage. However, for the past 10 years, what we have seen is that there has been a gradual trend in improvement in the way we treat ovarian cancer, and there are better ways, drugs which are now available. If the patient is offered them, the survival becomes better. The symptoms of ovarian cancer basically are non-specific. When I say non-specific, it means that ovarian cancer symptoms usually could mimic any of the symptoms of any other disease. The symptoms usually are bloating, feeling of fullness, feeling an urge to go to urinal frequently, pelvic pain, which could be non-specific, or any feeling of discomfort in the pelvis. Some rare symptoms could be acute pain, which can happen if there is some torsion of the ovary, but most common symptoms usually are distension or bloating of the abdomen. If such a symptom develops over a period of a few days, it must be brought into the notice of the doctor that there are some new changes happening, especially if the lady is above the age of 50 years. There is no specific screening recommendation for ovarian cancer. But for a patient or a person having these sort of symptoms, one can definitely consider abdominal imaging and a blood marker called CA-125. Abdominal imaging helps in the diagnosis of ovarian cancer. The sort of abdominal imaging which we look forward to is CT scan or MRI of the abdomen. The CT scan actually can help the doctors in staging grossly or giving some idea about the stage of ovarian cancer. CA-125 again is not a very specific marker though, but can give some idea that this could be a cancer of ovary. CA-125 could also rise in other conditions like endometriosis, tuberculosis of the abdomen, or even in any pelvic infection or pelvic inflammatory diseases. Ovarian cancer is diagnosed once radiological imaging is done and a CA-125 is elevated or might not be elevated at times, and then a biopsy is required at times. Sometimes, if it is an early ovarian cancer, that is, the mass or the tumor is restricted only to the ovary, then we call it early ovarian cancer. There, straight away one should consider going for surgery. If it is a widespread abdominal disease, then a biopsy should be considered prior, and sometimes you need to consider giving neoadjuvant chemotherapy after diagnosis if the patient is not in a position for surgery. Surgery for ovarian cancer is a very extensive surgery and requires meticulous and a very diligent procedure where each proper staging steps are followed and the disease is actually taken out in terms of what we call as R0 resection. There should be no visible disease present after the surgery. It is always better that the surgery is done in a center where ovarian cancer surgeries are done commonly, because it requires a lot of multidisciplinary effort in diagnosing as well as doing such meticulous surgeries. After a proper surgery is performed, patient is staged and accordingly treatment is given. Usually what we see is that 70 to 80% of the patients unfortunately present in stage 3 ovarian cancer, and that is how it usually presents because the symptoms are non-specific. When the patient presents, there are treatment options of chemotherapy, which is a very important aspect of ovarian cancer treatment after surgery. Sometimes before surgery, it is given as neoadjuvant chemotherapy. Also, apart from chemotherapy, there are new developments which have taken place, and that is targeted therapy. Targeted therapy is in form of injection, anti-angiogenic form, which is bevacizumab. Also, there are PARP inhibitors. Now, PARP inhibitors for the past 5 years have really turned the way ovarian cancer is treated. PARP inhibitors have made it possible to extend the life of our patients to several years, to several further years, which was not possible earlier. Now, what is PARP inhibitor? PARP inhibitor is basically a drug which actually inhibits the enzyme which is called the PARP, which is a DNA repair enzyme. This DNA repair enzyme is actually deficit in certain population of patients of ovarian cancer. This accounts for nearly 40 to 50% of our patients of high-grade serous ovarian carcinoma. So PARP inhibitors have definitely made a huge impact in treating the way ovarian cancers are treated in the past 5 years and should be offered to our patients who are undergoing treatment for serous ovarian carcinoma and other high-grade ovarian cancers. Thank you.